health is development. There's no way. I think we shouldn't be really talking about health and development as parallel things, because one is so so subtly related to each other. And through health, you reach development, and there's no development without health. And I think that also when we say that health is development, what we are really implying is every effort to improve people's health, and every effort which is really based on the people's access to the health system and health products can be driven by, can drive development. But I want to say something that we usually use as you know, Brazil has lots of regional differences, and parts of the poorer parts of Brazil are starting to say, look, we don't want to be part of the problem anymore. We want to be part of the solution. And if we take this concept, to the beyond a idea, which is really fantastic, it's really to think that these countries, and we are as a middle-income country, want to be a protagonist of that history. We don't want to be part of the problem anymore. We want to be part of the solution, and to some extent we have been fulfilling this role, and we want to be more proactive, and that goes all the way through discussing, sitting in committees and helping to shape this new world scenario in terms of health research. I think it's critical. Translating is actually, using a common language or getting people to talk a common language, and just, I think the basic principle is problem solving. And if you focus on the problems and we make all the effort to solve that problem, then we really need to talk, and we need to try and talk in a kind of common language. In Brazil, the situation is interesting, because we have basically 3 ministers of state relating to investments in health research. One is the health ministry, which has its own department for health research, but it's a relatively small budget for this department, and in comparison to the global budget for the ministry. Although that department is key to making links with the other governmental departments and saying to them, look, this is what the Ministry of Health is identifying as important. This is what the democratic process of the municipalities and state level governments and the social control is concerned. So the Ministry of Health is an interpreter to an extent of that communication. So the Ministry of Science and Technology is where, say, most of the budget goes to health, goes via the Ministry of Science and Technology, and the Ministry of Education takes care of higher education in terms of postgraduate courses and scholarships. So I think our role at the Ministry of Health is key to get everyone talking the same language, or at least. But it's interesting, because there are almost worlds apart, and the Ministry of Science and Technology understands publications, papers in the nature and papers in science. If you get a paper in science, you do very well in the Ministry of Science and Technology. Not necessarily in the Ministry of Health, because sometimes, at the Ministry of Health, the concerns are more kind of down-to-earth, more immediate kind of implementation research, as we learned this morning. So having the ability to talk through these different agencies is key.